Hello, I'm Holly Tanner with the Herman and Wallace Pelvic Rehab Institute, and I'm here with Dina Gordon, who is a physician who is writing a course for us. Dina, could you tell us a little bit about your background professionally?
Sure. So I am a generalist obstetrician and gynecologist, and I practice in the greater Seattle area. I'm currently affiliated with Swedish Medical System, and I really enjoy all aspects of obstetrics and gynecology.
Mm. And what was some of your experiences, perhaps in your training along the way, that really got you excited about helping folks with their bodies along the peripartum journey?
I think what's always drawn me to obstetrics and gynecology as a field is being able to educate and empower my patients. It's just a field that lends itself beautifully to education and autonomy, frankly. All fields should be. But I think working with patients in this particularly vulnerable stages of their life when often they don't feel empowered is something that has been a huge passion of mine. And I think even more so when I went through my own pregnancy and postpartum journey and realized, as someone who's as educated and knowledgeable as I am in the field, how much of the support around my pregnancy and postpartum journey came from other places and not my physician. Not that my physician wasn't phenomenal, it's just, it really helped me shine a light on the fact that the system doesn't allow for physician providers to do as much education as needs to happen. I learned a ton from my pelvic health therapists and my physical therapists in general, and personal trainers, and just lots of other folks. And I feel really excited to be able to share that information with other providers as well as my own knowledge.
hmm And that's what's so exciting for us as pelvic health clinicians when we get to interface with other providers, because you do have a very distinct level of knowledge and you're working in the field in such a direct way that our pathways with our patients really do intersect a lot, but we don't always know all of the details. Will you tell us a little bit about what folks can learn if they come to your course?
Absolutely. And I think, just to speak to what you're saying, I think it's been really amazing in my journey as a clinician to understand just how much the different health professionals working together really build the full puzzle, and how we all have these areas of knowledge that do intersect and overlap, but that really together we're so much stronger. So my course is really geared at sharing a lot of the medical information that happens during pregnancy and at birth. And so I'm going to take folks through sort of an overview of who are obstetricians and gynecologists, what do we know, what does traditional obstetrical care look like, so what's happening for patients when they are, before they're seeing you, or while they're seeing you, what they're doing simultaneously with their physician provider. And then I will touch a little bit on other types of providers that patients might see, so not just physicians. And then I'll talk about different things that can happen in pregnancy, so both normal pregnancy as well as high risk pregnancy, makes things high risk, what recommendations might come from physicians that could impact what pelvic health providers might or might not be able to do with patients. And then we'll talk about preterm birth and kind of go through what happens physiologically to folks during that birth process. And we'll use some videos to show that, and talk about some specific examples.
When you do interface with pelvic health clinicians, what are some of the interactions that you've appreciated, or what are some of the common questions you get? One of the perspectives I think, well, I know that a lot of clinicians have when they're newer to working with folks who are pregnant or in the postpartum period is there can be fear about this perceived fragility. Well, I don't want to hurt them. I don't want to do the wrong thing. I don't want to do something that's contraindicated. And yet there really is so much resilience and also just common demands on the bodies of folks as they go through their pregnancy and in that postpartum period. So Again, what kind of questions do you get or have you appreciated having dialogues about when we do see that intersection happen in care?
It's such a good question. And it makes me chuckle a little bit because it's true of most people who aren't obstetricians or midwives, I think, to be a little fearful of pregnant patients, right? That they don't want to hurt, they don't want to hurt the pregnant patient or the baby that's growing inside of them. But I think we don't do a service to that dyad because if we don't provide care that is effective, then we're essentially not accomplishing things, right? So plenty of physicians also will say like, "Oh, I'm not going to take care of you in pregnancy, or I'm not going to biopsy that because you're pregnant," and it doesn't make any sense. I feel like one one thing I hope to do by participating in these courses and building dialogue between myself and hopefully other physicians, along with our collaborative healthcare team, like pelvic health providers, is to make it easier for people to reach out and ask those questions. Because truthfully, I'm so rarely asked by pelvic health providers, is it okay to do this or not? And the
Mhm.
patient becomes the messenger rather than having provider to provider conversations about what do I recommend or what don't I recommend. I think the truth, though, to be fair, is that plenty of physicians are just as fearful and not knowing what's going on in a pelvic health office. And so I think physicians are sort of like, well, I don't know what they're doing. So how can I know if what they're doing is safe or not? Right. And so I think I want to be able to answer your question by saying, oh, I love when people ask me, can I have my patient do jumping jacks, or when should I know that I am causing too much pressure? And I think the simple answer is that if someone's having pelvic pain from something you're doing, you might need to back off. But I don't get those questions very often because
Mhm.
communication isn't very smooth,
Mhm.
unfortunately.
Well, and that's what will be so exciting about this class is people will really be able to get inside your brain and say, okay, but when you are doing a C-section surgery, why would you do it this way? Or do you think about sewing this up to that? Or what if something gets adhered that you didn't mean for it to happen? What are the potential ramifications and things to mitigate that, right? Like it's just, I think it will be so
Yeah,
fun for people to process all of the thoughts they have and the questions they have, and to really hear in real time what it can look like and sound like and feel like for you in the operating room, in these postpartum visits, and just that whole journey.
absolutely. And I love that you asked those questions because those are all going to be covered in my C-section
Mhm.
lecture.
Nice.
But there'll be tons of opportunity to ask more questions about things and have those discussions. So I think it's going to be great.
Mhm. In your experience, when have you identified, "Ooh, this is what makes a good pelvic rehab clinician?" When do you get impressed?
I get impressed when patients get better. I get
Sure.
impressed when I say, so tell me in your visit, did they do an exam? Did they do an internal exam? Did they talk to you about what they were doing? A lot of patients say that they were not examined, like they didn't get undressed at any point during their whole therapy session. And I'm trying to read through the notes and understand sort of what assessment was made. But yeah, I think when pelvic health clinicians aren't afraid to examine patients fully and thoroughly and potentially cause some discomfort for those patients in order to help them improve, of course, with the patient's consent, that's when I'm really impressed.
Mhm. Again, that collaborative care is just so much a part of the day-to-day functioning in the care of these patients, and it's been a real treat here in Seattle to be able to work with some of your patients, and again, to be able to ask those questions and get some feedback about what we can do or what the other options are. So we're really excited that you took the time to put this course together. And again, I know people are going to be so excited to be able to truly get inside your brain a little bit and understand your perspective and how that influences all of the pieces of this sometimes very challenging puzzle.
Absolutely. I'm really excited for it too. So thanks for letting me do it.
You bet. Thank you, Dina.